This is Dr. Kathryn Dao reporting for Room Now, and I'm at ACR 2020 watching this virtual conference for the ACR Convergence. And I wanted to share with you an abstract that was presented at the plenary session this morning. It's abstract number 0433. And basically, this abstract was looking at race discrepancy and how patients with lupus have a higher risk of stroke and heart attacks if they're Black. So this is really important because, the majority of patients who are affected by lupus severely actually are Black patients, and this only confirms it, but also it identified some novel factors that can contribute to this risk. So this is a Georgia study. It actually was looking at the Georgia Lupus Registry from DeKalb and Fulton counties, where 50% of the population is African American, 15% poverty rate, and 41% had college degrees. And they found 336 patients who had lupus and who actually suffered from either stroke or ischemic heart disease. The average age was about 40, 87% were female, and 84% had hematologic disorders. So that could be anything from low platelets, low white blood cells, or hemolytic anemia. And then 66% had arthritis, 31% suffered from lupus nephritis, 14% from discoid lupus, and 9% from neurologic disease. What was interesting about this study was that the greatest number of strokes were found within the second year of diagnosis. And not only that, the greatest proportion of ischemic heart disease was after 10 years of diagnosis. Now, there's other studies out there that had mentioned how cardiovascular risk is pretty high for strokes and heart attacks, even within the first year. What the results of the study found was that Black patients actually had a 3 times higher risk of strokes and 24 times the risk of ischemic heart disease compared to white patients. It's a p-score of 0.007. And the predictors of stroke was being Black, having discoid, and also having renal disease. And then the predictors of ischemic heart disease is being older than 65 years, Black race, neurologic and immunologic disorders. So this includes antiphospholipid antibodies as well as other antibodies. Now, the strength of the study is that this is a population cohort, and it's a pretty diverse cohort looking at the highest risk population for lupus and their complications. They did a really robust cardiovascular screening. They did not account for smoking, hypertension, the traditional cardiovascular risk though, or the use of steroids and hydroxychloroquine. They were missing a few data points. But the reason why I feel that this study was so important is because, most of our patients who have lupus and who are of ethnic minorities, they do suffer from more severe ischemic heart disease as well as strokes. And we have to be aware of that and modify as much risk factors as we can and be vigilant about symptoms that they may present. We need to be counseling them to exercise. We need to be counseling them to lose weight, eat a healthy diet, and then ask those traditional cardiovascular questions like, are you having any chest pain? Have you gotten your lipids checked? If you don't check your lipids with your primary care doctor, I think as rheumatologists, that's something that we need to do to help our patients. So I hope this gives you a little bit of a perspective in terms of how race affects lupus. Again, this is Dr. Kathryn Dao reporting. Please follow me on Twitter at KDao2011.